What are some of the most common reasons why you should not go to an emergency room? I came up with about 3 to 5 reasons why we commonly see patients in the emergency department who really don't need to be in an emergency department. Number 1, chronic pain. A lot of patients show up to the emergency department who have known diagnoses for pain syndromes, whether it be chronic back pain or neck pain, peripheral neuropathy caused by their diabetic state, who are already on medication for their pain syndrome. They run out of their medication and then they come to the ER to try and get more pain medicine. That's not what the ER is supposed to be for. You should be following up with your primary care doctor or your specialist who's prescribing you that medication so that you can get refills in an appropriate fashion. To do so otherwise indicates that you're probably not taking the medication the way it's prescribed. And when you come to the emergency department, that's one of the first things we're going to want to find out. Whether you're taking it the way it's supposed to be taken, and why is it that you ran out of your medication in the first place? It's really not an emergency problem in most cases, so it should be handled outside of the emergency department. Another common reason why people come to the emergency department for what we consider to be non-emergent reasons is to get refills of their medication. Sometimes people will come because they run out of their blood pressure medicine or they run out of their diabetes medicine, and rather than getting in contact with their primary care physician or at least waiting until it's time for them to be able to get their refills, they'll show up at the emergency department with a complaint of a headache or a complaint of dizziness that they think is as a result of their blood pressure being too high. Usually the blood pressure is normal and they just need a refill of their medication. This is not an emergency and it should not be dealt with in an emergency department. Another very common reason, especially during the time that we're sort of transitioning out of the pandemic, is upper respiratory infections, particularly viral upper respiratory infections. If you have symptoms of low-grade fever, body aches, cough, and you've not developed serious symptoms, severe shortness of breath, temperatures over 103 degrees that are not responding to usual methods of bringing the temperature down, like Tylenol or ibuprofen, then you probably don't need to be in the emergency department for that. When you come in, if we diagnose you with an acute viral illness, even if it is COVID, or even if it is RSV or one of the more considered serious viral infections, if you don't have symptoms that necessitate hospital stay or acute hospital treatment, we're not going to give you much of anything for it, and you could have taken the medication that we would prescribe from home anyway. Usually Tylenol or ibuprofen to help with body aches and fever. Drink plenty of water and get plenty of rest, and in most cases, acute viral illnesses will resolve on their own without any additional treatment. Not really an emergency. Another thing that we commonly see in emergency departments is moms bringing their little children into the emergency department who have acute onset of symptoms. Baby has been throwing up for 2 or 3 hours. Baby has been having a cough or a runny nose for just a day or so. And the cough and the runny nose is not associated with a high-grade fever. The mucus that's coming out of their nose is clear, and they bring them to the emergency room for evaluation, usually like 12 or 1 o'clock in the morning. This is not considered an emergency. Something that can be handled by conservative treatment, saltwater nasal drops for the baby with a bulb suction to help clear the mucus, cool mist humidification in the room to help keep the mucus nice and thin, and if a low-grade temp arises, Tylenol dosed appropriate for age and weight, and maybe even some children's Motrin, and then a visit to the patient's pediatrician. Not considered an emergency. I happen to work part of what I do in medicine in the emergency department. I'm actually the medical director for one of the local emergency departments here in the Columbus, Phoenix City area. And as such, I think we need to talk just a little bit about what really is an emergency department for. Well, it's kind of implicit in the name. It's supposed to be used for emergency medical care. Now, what constitutes an emergency? Generally, it's considered a potentially or an imminently life-threatening condition. Motor vehicle accidents with major trauma, heart attacks, strokes, acute exacerbations of chronic diseases like congestive heart failure or COPD that if not attended to emergently can lead to death. That's what an emergency room is really supposed to be for. Unfortunately, in this country, many of the emergency rooms are now being used more for urgent care or even primary care reasons. People coming to the emergency room for things other than what is considered to be an emergency problem. I hope you like the content. Don't forget to hit the like button. If you've not already done so, subscribe to the channel so that you can be abreast of all of the new information as we bring it out, and hit that bell notification, and then you'll be among the first to know when new content is released. God bless you.